I'm Sam. I am an RCS at the Adult OCD and Anxiety program here in Oconomowoc. And a day as an RCS in Oconomowoc is predictably unpredictable, if you will. You're going to wake the residents up in the morning, help them through their morning routine, hygiene, collecting their morning vitals, passing them their morning medications, and making sure that they are where they need to be when programming time officially starts for the day. As the day goes on, follow the same kind of pattern, help them with programming until that time ends for the day, and supervise and support people as they need during the evening. When I say predictable, that's the part I'm talking about, but when I say predictably unpredictable, it's because with any of those tasks that the RC manages throughout the day, people will need different levels of support, different levels of encouragement, and different levels of attention from the RCS staff to help them through, which is something I really enjoy about the role. It does require a little bit of technological literacy, but it's something that anyone can really learn. Something that the RCS does is enter patient charts. What we observe during the day that's relevant to their treatment, we actually document, and it goes into their official medical records. And in addition to that, besides what we actually put into the chart, that's also the resource for us to learn more about our patients, because anything that they're working with their treatment team is going to be documented in there as well, so that anything that you might need to know about someone that they are not forthcoming with, things that they struggle with, why they're in Roger's care, you can find in that software. So it really helps to kind of gain a comfort level with that software. In addition to being a therapeutic role and a clerical role, the RCS, it is a medical position in a lot of ways. Have we gone all so far today?
Yeah, so far so good.
We take vital signs for patients during the day. Nursing and other people will step in to do that if there's a need or if a need arises. But the daily expectation for those vital signs to be taken is that the RCSs are going to be doing that every single morning. The same thing applies with medication administration. Unless there's some sort of strange exception that needs to be made, RCSs are the ones administering meds 24 hours a day to the people who need them. It takes a while to kind of get into a groove and get into a comfort level with medication administration, but there is a lot of support to make sure that you're able to do that successfully. Something that we do here to ensure that safety is properly enforced on a residential unit, the doctors will decide how frequently per hour each resident needs to be checked on. And then it falls to the RCSs to ensure that those checks are actually getting done. We actually have a digital system. We carry iPads around with us and make sure that we're documenting our observations of where our residents are at any given time. That can be somewhat of a physically demanding task. I mean, our unit here it's one long building. It's almost a quarter mile from end to end. And the more you do that during the day, the more time you're spending on your feet. So that's part of the physical aspect of the job. I think another thing on top of that is we have hydration fridge here for people who are needing a certain amount of fluid intake. We have a snack cart that we keep fully stocked. It's our responsibility to make sure that those things have everything that they need. It's not a lot, but I think it would be false advertising to call this a desk job. There are times where the treatment teams will deem it therapeutically beneficial for a resident to go off grounds. And sometimes they'll be the ones responsible for that. Other times that'll be us. Residents will go in small groups to a Target or a Walmart just to restock hygiene and snack items for their personal use. And we are the ones transporting them to there, supervising them while they are at whatever activity they're doing, and making sure everyone is accounted for and brought home. Something that it took me a while to kind of be able to put to words is that the RCS wears many hats. It's clerical, it's administrative, it's therapeutic, it's medical, it's all of those things. And it kind of takes a while to get used to being in all of those roles simultaneously. But once you start to gain a comfort level, and once you gain a competency in the RCS role, you kind of start performing it as second nature. Things just start coming to you naturally almost, because you just get in that groove of things. And once you get in, it's pretty hard to get out, which is a good thing. I think something that really keeps me going, that keeps me coming back here every day with a new sense of purpose, is there's a genuine gratitude expressed by our residents here. I've heard people say the phrase that Roger's helped them get their life back more times than I can count. And being an integral part of that, being a part of the patient's care 24 hours a day as an RCS, and hearing them say how much you helped them at the end of their stay, it never gets old.